So next is breast infection. So first scenario: a 25-year-old breastfeeding mother presents in A&E with hot, painful breast. What is likely cause and how will you manage her? So it looks like lactational mastitis, which occurs in 5% of the feeding mom, most common in the first month and during weaning. So I will take a history and examination. I will examine his breast and axilla, check for the cracked nipples, problem with the milk flow, breast pain, and systemic sepsis. So here our sequelae is either three conditions: either she got cellulitis, she got full-blown systemic sepsis, or she got abscess. So if she is systemically well and no obvious abscess, it's only cellulitis, then she needs a broad spectrum antibiotics. So flucloxacillin against Staph aureus or clarithromycin if penicillin allergic, and then follow up in the clinic. If septic, then she needs admission with IV antibiotics, and then she will be monitored. If breast abscess suspected, then arrange ultrasound guided drainage and send pus for microbiology and culture sensitivity. Ensure patient is followed up in the clinic after the resolution of symptoms. Okay, so next is 40-year-old woman presents with a painful red mass close to her nipple. What is the cause and how will you treat? So it's close to the nipple. It looks like periductal mastitis. So it's associated with heavy smoking. So it's polymicrobial, including aerobic and anaerobic bacteria. So these patients need metronidazole as well. So present with peridural inflammation, mass abscess may be chronic or recurring. So in these scenarios, I will take a history and examine the patient, including the smoking history, previous abscess, surgery, or skin necrosis. And then the treatment she needs will ultrasound guided draining into local anesthesia and rescan and drain every 2 to 3 days until resolution. Formal surgical drainage is done only when the skin thinning or necrosis occurs. If septic, admit for intravenous antibiotics. Any woman more than 40 years age needs a mammogram after resolution of inflammation to exclude malignancy. Encourage the patient to stop smoking, high recurrence rate, and sometimes it can make the fistula, mammary duct fistula. So next scenario is a 70-year-old woman presents with a hot, red, painful breast. What is the likely cause and how will you treat her? So she is 70 and I will take history because here I am concerned she might have inflammatory breast cancer until proven otherwise. So it happened 1 to 5% of all the breast cancer, very aggressive locally advanced breast cancer that spread to the dermal lymphatic vessels. Dermal lymphatic vessels, giving erythema, discolored, swollen, edematous appearance to the whole breast. Take a history and perform a triple assessment. So clinical examination may reveal breast mass, POD orange, palpable axillary nodes, mammography, ultrasound, core biopsy. Review results in MDT, arrange staging CT, bone scan, give neoadjuvant chemotherapy prior to surgery. And that's it.